my name is Denicia Ballard, and today we'll be going over the gut microbiome versus chemotherapy. The microbiome is a distinct ecosystem inside of your intestines populated by trillions of microorganisms that aids in digestion and metabolization, immune system response, and even helps to stimulate production of neurotransmitters. Chemotherapy is a cancer treatment that uses drugs to reduce cancer cell growth by targeting rapidly dividing cells. Chemotherapy mostly affects cancer patients. A little diagram I gave you that shows you where your microbiome is and just some of the things that it does for you. So, breast cancer. Breast cancer occurs when cancerous cells in breast tissue multiply and become tumors. Who does it happen to? It is the second most common cancer in women. It is most common in women 50 years or older, but can occur in men and younger women. 1 in 8 women in the U.S. and an estimation of 3,000 cases in the U.S. this year alone. Why does it happen? There is no true cause for breast cancer. There are only, or at least that has been discovered so far. But there are only so far known risks that elevate your likelihood of developing cancer. And these symptoms, a change in shape or size of breast, a mass/lump, or a change in look/feel of nipple or breast, or even blood-stained or clear discharge coming from your nipple. These are just showing you some of these standard treatments for breast cancer and the one we are going over today. The microbial richness in the gut microbiome is lower in breast cancer patients who recently received chemotherapy than breast cancer patients who hadn't received chemotherapy for 6 months prior. In this same study, breast cancer participants had significantly lower abundance of Akkermansia than healthy control participants. Akkermansia is a gram-negative bacteria that naturally occurs in the human gut microbiome. And this is just a chart showing that the microbial richness or the amount and diversity of different microbes within a microbiome is less in women that have breast cancer and are undergoing chemotherapy than ones who do not have breast cancer and are not going through chemotherapy. The gut microbiota, specifically Enterococcus and Barnacella, can restore the anti-tumor efficacy of certain chemotherapy by stimulating tumor-specific T cells. And this duo can also increase effects of another chemotherapy by regulating the function of some other T cells and TME through interleukin-2 signaling. My main source of information was about a study that was done with 21 women diagnosed with breast cancer and undergoing chemotherapy and 14 women who were healthy, no cancer, no chemotherapy. And in this in this study, a series of tests were run to examine the effects of cancer and chemotherapy on one's cognition, mood, and gut microbiome. This box plot right here is showing you the microbial diversity of women diagnosed with breast cancer versus women that are not. As you can see, there is a big difference in the diversity of their gut microbiomes. This one is showing you the depression scale scores in accordance to the microbial diversity once again. So as we're seeing lower scores of diversity in your microbiome, higher depression. The results for this study were that breast cancer participants all experienced delayed cognitive function, more symptoms of depression, and higher levels of disruption in diversity and community of the microbiome than the healthy control group. So this box plot right here is showing you the Akkermansia abundance in breast cancer patients and healthy participants. So, yeah, for future research, there are hopes for more research, but as of now, there is no research coming anytime soon. Key takeaways are the diversity and community of the gut microbiome is disrupted by the use of chemotherapy to treat breast cancer. The microbiota in the gut are able to aid in restoring the efficacy and increasing anti-cancer effects of specific chemotherapies. Everyone, especially women, should get examined regularly. To lower risk of getting breast cancer, avoid obesity, eat right, exercise, avoid smoking and drinking, avoid radiation, and avoid hormone replacement therapy. And these are my references. Thank you so much.